Today is Monday, May 11th, and this is VOA's International Edition. I'm Lori Lundin in Washington. Coming up, 3 key U.S. coronavirus officials are in self-quarantine after COVID-19 exposure. Europe is beginning to ease restrictions, but it will not be a fast process.
Generally within Europe, it's expected now that you just stay home. And when you look at France at the moment, until June at least, people cannot travel more than 100 kilometers from their place of residence unless they have a very good reason to do so.
Also ahead, a rock and roll pioneer has died. It's all on today's International Edition. Vice President Mike Pence is self-isolating after an aide tested positive for the coronavirus last week. Pence has repeatedly tested negative for the COVID-19 since his exposure, but is following the advice of medical officials. But AP correspondent Ben Thomas reports 3 Whitehouse virus task force members are also now in quarantine.
The National Institute of Allergy and Infectious Diseases says its director, Dr. Anthony Fauci, has tested negative for COVID-19, but is among the 3 task force members on quarantine. The others are the director of the Centers for Disease Control and Prevention, Dr. Robert Redfield, and the commissioner of the Food and Drug Administration, Stephen Hahn. NIH and CDC describe the exposures as low risk. Both Fauci and Redfield intend to telework from home, though both will go to the White House if called. If that happens, the CDC says Redfield will follow CDC practices for critical infrastructure workers, including wearing a face covering and distancing himself from others. Ben Thomas, Washington.
More than 4 million people have been reported to be infected by the novel coronavirus worldwide, and more than 277,000 have died. The number of deaths in the U.S. surpassed 80,000 over the weekend. New York's governor announces new rules for nursing homes as deaths mount, and also investigations into additional deaths of children from what's now being identified as a COVID-related illness. AP correspondent Julie Walker reports.
Governor Cuomo says staff at nursing homes must get twice-weekly coronavirus tests, and if they can't take care of a resident, they have to transfer them. Also, COVID patients leaving hospitals can't be sent to nursing homes.
If a nursing home operator does not follow these procedures, they will lose their license.
Cuomo also says the state is investigating 85 potential cases of a COVID-related illness in children with symptoms similar to Kawasaki disease or toxic shock-like syndrome.
It is a situation that has taken the lives of 3 New Yorkers. There are 2 additional deaths that are currently under investigation.
And in honor of Mother's Day, he had his mother, Matilda Cuomo, virtually join him at his daily news conference. Julie Walker, New York.
Nations are feeling pressure to reopen shuttered businesses and aspects of life amid worries that relaxing restrictions too much could ignite a second wave of coronavirus infections. Lockdowns are being lifted across Europe, even as some countries see a rise in cases. Joining us to talk about it is Paris-based journalist Catherine Field. Catherine, so how are countries in Europe going about reopening?
It is going to be gradual. It's going to be an easing back to a normal situation, but we're all being told that normal situation that we're used to will not happen before September. Here in France, of course, today it's back to work for most of the country. For those people who cannot work from home, they will be going back to work. There will be a few restrictions, such as if you use public transport, you will have to wear a face mask. Here in Paris, if you are going to use public transport, you have to have a letter from your employer to say that, yes, you are going to work, but only if you're going to work will you be allowed to use the public transport system. When you look elsewhere in Italy, schools are still closed, retail businesses are still closed. They won't be open again for another week. And in Spain, we are starting in the next couple of days to see restaurants will be opening again. So again, we're seeing a gradual easing, but again, the word is always going to be prudence and social distancing. The other thing, of course, is Europe is going to have to do more and more testing, especially here in France. They say that's the key to France being able to open up. Testing, tracing and quarantining, but always, as we're seeing, the threat that it could all, if the numbers start going up again, the lockdown will come back.
But isn't it true, though, that some countries that are starting to slowly reopen are also already seeing their numbers going up?
Indeed. In Germany, we're seeing just over the last few days the number of cases going up and the reproduction rate going up. In Germany, we've seen in the last 2 days the reproduction rate going up above 1.1 in some cases. So that represents the number of people who have the virus who are reinfecting people. So that is a concern. The problem with Germany is that Germany is a federal state. So each state can have its own restrictions and it's really not up to the central government. Again, though, it's been a gradual reopening. That is the concern. If there's too many people on public transport, not enough social distancing, these serious lockdowns that we've seen in the last few months will come back into place.
And you mentioned testing and contact tracing. Are most European nations equipped to be able to do that, unlike here in the U.S.?
The big problem with the testing and the tracing is consumer protection. It is a big issue here in France. People do not like the idea that the state will have so much information on them. They don't like the idea that if you go to the doctor, that you find out that you have got the virus, and the physician is then obliged to tell the government. It's also obliged to tell the government and the authorities where you live, how many people live in that particular apartment or in that house. So that is the problem, is how do you protect people's personal information, but at the same time making available that information to the state so as they can keep everyone safe.
What about the UK? They've had a rise in cases there.
It is. The rise in cases in the UK is being very worrying. Largest number of deaths in Europe. We're looking at 31,000 deaths. It was expected there'd be some sort of easing of the lockdown restrictions this week, but the UK Prime Minister Boris Johnson, in an announcement to the nation on Sunday, said that these restrictions would stay in place. Again, they're saying that if you can't work from home, then you can go to work, but we'd rather you stayed home and work from there, which is fine if you have the sort of job that you can do that. But again, you're looking at a lot of people who are going to have to be taking public transport to get to their work. You're seeing there's concerns about how do you get people who need to go to work to get to work without using public transport. And in the UK and also here in France, you're seeing a lot of movement towards getting people to use bicycles, more bicycle lanes, getting cars off the road. And that could be the key to making this work, because here in Europe, we're now into spring, people will be able to use their bikes more.
What about the EU as a whole? In Europe, normally people travel all the time from country to country. Are Europeans allowed to travel across the bloc?
No, it's very restrictive. You have to have a reason for going somewhere. Even though there is this 27 nation Schengen agreement that there are no borders, you have to show a reason for crossing the border. Mostly you're seeing that in particular at the moment with seasonal workers for picking vegetables, picking fruit. They're generally coming in by plane. You're also seeing people who, for example, live on one side of the border, work on the other. They have been given special passes to go through. But yeah, those borders are still there. Non-essential travel within Europe is frowned upon. And French President Emmanuel Macron just last week did say to the French people, do not expect to go on a summer holiday this year. Perhaps by the end of summer, you might be able to go to some other European country. But generally within Europe, it's expected now that you just stay home. And when you look at France at the moment, until June at least, people cannot travel more than 100 kilometers from their place of residence unless they have a very good reason to do so.
Paris-based reporter Catherine Field. Here are some of the other stories we're following at VOA. Japan's health ministry says more than 90% of hospital beds secured for COVID-19 patients in Tokyo have already been occupied, underscoring the pressing need there to curb the further spread of the new coronavirus. A major U.S. airline trade group is backing the U.S. Transportation Security Administration plan of checking the temperatures of passengers and employees who interact with customers during the coronavirus pandemic. Temperature checks will also provide additional public confidence that's critical to relaunching air travel and the nation's economy. Some airlines are also requiring passengers wear face masks. And 3 children in New York have died from a rare inflammatory syndrome believed to be linked to the novel coronavirus. Governor Andrew Cuomo said Saturday a development that may indicate a pandemic risk for the very young. Cuomo and his counterpart in the neighboring state of New Jersey talked on Saturday about the pandemic's growing toll on mental health. Another factor on the minds of governors across the nation as they weigh the impact of job losses against health risks in moving to loosen restrictions. Stay with VOA for all the latest U.S. and world news. UN agencies are warning migrants and refugees crossing the central Mediterranean Sea risk losing their lives if European nations continue to prevent search and rescue vessels from saving those in distress. Lisa Schlein reports for VOA from Geneva.
The UN Human Rights Office expresses alarm at recent reports of rescue boats failing to assist migrants in trouble on the central Mediterranean Sea, considered to be one of the deadliest migration routes in the world. The agency deplores the coordinated pushback of migrant boats by nations and by hard-nosed policies by some European countries intent on preventing private humanitarian search and rescue vessels from supporting migrants in distress. Human rights spokesman Rupert Colville says these life-threatening actions are occurring at a time when an increasing number of migrants are making the perilous journey from Libya to Europe.
We call for restrictions on the work of these rescuers to be lifted immediately. Such measures are clearly putting lives at risk. In the first 3 months of this year, there's already been a fourfold increase in departures from Libya compared to the same period in 2019.
Colville says his agency is concerned about the many refugees and migrants who are being returned to Libya after they are rescued at sea.
The Libyan Coast Guard is continuing to turn vessels back towards its own shores and place the intercepted migrants in arbitrary detention facilities where they face horrendous conditions, as we've often spoken of in the past, including torture and ill treatment, sexual violence, lack of health care, and other human rights violations.
Colville says the overcrowded conditions under which migrants are kept expose them to the threat of coronavirus infections. UN agencies are calling for the release of all refugees and migrants in Libyan detention facilities. They advocate a return to the age-old tradition of rescue at sea, which was enshrined into law in the last century. Lisa Schlein for VOA News, Geneva.